Hi, Mr. Schaefer.
Hi, what's going on?
Hi, I'm Ella. I'm going to be the nurse practitioner who's doing your exam today. What would you like me to call you?
Will.
Okay, perfect. So today, Will, what we're going to do is I'm going to get your weight, your height, vitals. We're going to go over any type of pain you're having, and then we're going to do an abdominal assessment, okay?
Sounds good.
So to start off, what I'm going to have you do is just step here on the scale for me. We're going to see how much you weigh. Okay, 212. Is that about where you've been typically?
Yeah.
No recent weight gain or weight loss?
Nope.
Okay, good. So go ahead and take a seat for me. We're going to start out with getting your vital signs. So what I'm going to do first is get out my thermometer here. I'm just going to have you stick this underneath your tongue for me. Okay. 98.4, perfect. Next, I'm just going to feel for your pulse. So just breathe normally for me. All right, so your pulse was 64, and William is a young athlete, so for athletes who are in better shape like that, that's not abnormal to have a lower heart rate. So as I was looking at my watch, checking the pulse, I also was assessing William's respirations, and typically you're not going to want to tell your patients that you're assessing their respirations because that can alter, they'll feel like they have to try and slow down their breathing, or it can make them anxious, so you can kind of do both of those exams at the same time. So William's respirations were 14, his heart rate was 64, and next I'm going to get his blood pressure. So what I'm going to do, Will, is put this here on your upper arm. Do you have any type of high blood pressure that runs in your family or anything like that, Will?
No.
So just go ahead and breathe normally for me there. I'm just going to take a look. I'm going to put my stethoscope right here. Perfect. It was 114 over 70 minutes, and that is within normal range. We typically like to see people's blood pressures below 120 over 80. Okay? Now, Will, are you having any type of pain that you deal with?
No.
And I know you've had history of some surgeries. Do you have any pain coming back from any of those?
Nope.
Okay, good. So now what I'm going to have you do, Will, is I'm going to have you lay here on the bed, and we are going to go into your abdominal exam. So go ahead and lay down, put your head back, and I'm going to have you lay flat, and I'm going to have you expose your stomach just to below your chest line there. So go ahead and lift up your shirt for me. Perfect. So to start off the abdominal exam, what I'm going to do is just physically assess his abdomen. I'm going to look for any discoloration, any hernias, any visual masses or anything like that. No bruising or discoloration that I'm noticing, but those would be some other things that I would want to check for when I'm starting out with my exam. So next, what I'm going to do is I'm just going to do a soft palpation through all of the quadrants of his stomach. Now, Will, I'm sorry, my hands are a little bit cold. And I'm also going to listen with the bell of my stethoscope just for active bowel sounds. So you're just going to feel my stethoscope here. Good. And now I am hearing bowel sounds in all four quadrants. Typically, if you're not hearing bowel sounds, you're going to want to listen for a full 5 minutes because you cannot say that there are no bowel sounds until you've listened for a full 5 minutes. Also, you want to make sure that you listen before you feel, because after you palpate, you could stir up bowel sounds within this patient's stomach. So next, what I'm going to do is I'm going to start down here in the right lower quadrant, and I'm just going to do a soft palpation. You tell me if you're having any discomfort when I'm doing that, okay?
Okay.
I'm just using the 4 tips of my fingers, gently pressing down and just going in a swirl motion here. And as I'm doing this, even if the patient's saying that they're not having any pain, you're going to want to also look at their face, because they could say they're not having any, but then they could wince in pain. So you want to make sure that you do that as well. Next, what I'm going to do is a little bit of a deeper palpation. So I'm going to do one hand down, and then I'm going to press down with my second hand on top and do that same swirling motion. And this would be feeling for any masses, any enlarged organs, anything like that. Any pain as I'm doing that, Will?
Nope, all good.
Okay. Very good. So we're all good with that. Next, what I'm going to do is specifically look for two of his organs. I'm going to look for the liver and the spleen. So to do the liver, there's a couple different ways that you can do it. What I'm going to do is the hooking motion. So what I'm going to do is I'm going to hook my fingers with both hands right underneath his rib cage and have him take a deep breath in. Typically, it is not abnormal to not feel the liver when you're palpating, but if he were to have an enlarged liver, or while I'm doing this exam, I may be able to feel it. But it does typically live underneath the rib cage on the right side. If somebody's liver was enlarged, you would feel it a little bit lower down into the abdomen. So what I'm going to have you do, Will, is take a nice deep breath for me. Good. And the deep breath causes the lungs to expand and for it to push down on the liver. So like I said, I did feel a little bit of the liver as he takes that nice deep breath in, and you can feel that coming down. Next, what I'm going to do is assess for the spleen. So with that one, I'm going to reach across over here and have him take another nice deep breath in. Good. And now it is also not abnormal to not feel the spleen when you're doing that kind of exam as well. So lastly, what I'm going to do, which is not always involved in abdominal exams, but for today's purpose, I will do that. I'm going to percuss all 4 quadrants of the abdomen. So did you have any pain or anything like that? Any questions about the exam that I did today, Will?
No, I think we're good.
Okay, and that'll complete today's exam.